Welcome back. Well, the South African Medical Association has expressed its reservations following the arrival of more than 200 health experts from Cuba to help South Africa win the battle against coronavirus. SAMA says government should first exhaust all the skills available locally before seeking outside assistance. Now, the association says the money spent on Cuban doctors could be better spent elsewhere. For more on this, we are joined via Skype by SAMA's national chairperson, Dr. Angelique Coetzee. Doctor, thank you very much indeed for your time. Very good morning to you.
Very good morning, and a good morning to all the listeners and viewers out there. So, yes, SAMA noticed with concern the arrival of these Cuban doctors.
Why?
Yes. We think it's premature at this stage. We still having the COVID-19 pandemic currently under control. We know that once if this lockdown is going to be partially lifted, that our numbers might increase. But we have a lot of doctors in our country who is unemployed. Actually, not unemployed is not the right word. We've got a lot of doctors that is retired and above the age of 60, 65 with a lot of clinical experience that would gladly be able to assist, and also training for those young doctors who lack maybe experience in the clinical field and mentoring them. And also with the nursing staff, if we can first use our own internal people and doctors, then once you exhausted that and you see that there is a need, then you bring in other people from outside. It doesn't matter whether it's Cubans or any other doctor. It is not about the fact that it's a doctor. It's about the fact that the principle is that you should first look at your own country, get your own country to be worthwhile, and get your own people employed.
So two things, Dr. Coetzee. Two things from what you said. You say that it's premature to bring them here. You say we have things under control. How can you definitively say that we have things under control at this stage? That's number one.
It's easy to say that if you look at what the measurements was that has been put in place. Remember, we have, from the South African perspective, we had we brought in the lockdown in a very early stage. Once when we saw what was happening to other countries, we brought that in very, very, very early. We didn't need experts outside of the country to tell us what to do. We've got a lot of experts in our own country to assist us. And again, we haven't done badly. If you look at our numbers, around about 5,000, and you look at our death rate, so far we have managed quite well. We're not saying that is not going to change. That's why we say it's prematurely at this stage. We have done much better. The WHO, World Health Organization, also applauded South Africa for the way that we are treating and handling this COVID-19 matter. So yes, I can say that we currently are not doing bad.
Look, we've been told by experts as well as the health minister as well, we're still in the early stages of this fight against COVID-19. So we need to be better prepared in that. There's lots of unknowns, as you would know, with regards to COVID-19. We're learning every day. So all the help we can get, many are saying, we need to take it. With regards to the skills that we have currently in South Africa, we understand that those people from Cuba that have arrived here, you see on your screens, are specialized in their field. They're specialists in their field. We talk about epidemiologists, physicians, healthcare technology engineers, biotechnology experts. Are you saying that there are, for instance, epidemiologists, physicians sitting at home and not being called up? That's why, we need to go to Cuba.
No, we should not go to Cuba. We should first employ those people in our own country. We do have all that skills in our country. I do not for one moment think that we have not having anyone with those skills. We have them. South Africa is a very resourceful country. We've got a lot of resources. First, get your own people especially the people who's been retired. There's a lot of people who's retired who will not go out into the cold face. Remember, the people coming in is also not going to go into the cold face. There might be some of the family physicians coming in that will maybe go out and see patients in the deep rural areas, but their function is more to assist the healthcare workers and to help getting the process going and to make sure that if a healthcare worker pick up a patient, what to do, help and assist them. It is not as if these these doctors coming in are going to be the front line in examining and seeing patients. I think we need to be clear on that.
So how many doctors do you have, say for instance, in rural areas currently on the ground assisting?
Well, we have in South Africa, or SAMA, we have 16,000 members. There is about 32 plus registered family doctors at the Health Professionals Council of South Africa. Whether all these doctors are really working in South Africa, we're not sure, but we can tell you that the 16,000 doctors that SAMA is currently having is working in South Africa. And there's a lot of skilled people. Also, remember the family physicians coming in. We have the Society of Family Physicians. They needed to be contacted as well. Ask them, do you have members that can assist here? Also, the old GPs that retired got a lot of experience. Remember the Cubans coming in, those that will predominantly be working with the healthcare workers. There's a language problem, which if you use your own internal people, that would be less. Also remember, South Africa has got the highest HIV and TB rate in the world, which the Cubans doesn't have. And hereby, we're not saying that the Cuban doctors are not good. Please don't get us wrong. They are unfortunately being caught up in this political drama that's now playing out. And we cannot badmouth them. We cannot ignore them. We have to work with them and assist them. But it is the principle that's wrong. Whenever in future National Department of Health or the presidency want to bring people in from the outside, especially in the field of medicine, it would be prudent to have a meeting with the societies and the most representative bodies and to sit and let us have a consultation process and see what we can do with our own internal people, and only then you go outside and go and look for skills.
We fully understand that there are a lot of skills in South Africa currently, but I know we're running out of time. I just want to squeeze in just one quick question. Practically, how would this work now? How would government have better done this process or gone through this process? Would they have reached out to organizations like yourself in order to identify those skilled personnel that are basically sitting at home and waiting for the call-up?
Yes, that would have been the best way to go. Remember, SAMA is representative of more than half of the doctors in South Africa, but we also work together with all the other societies. So in the end, it doesn't become only a SAMA thing. It becomes where we try to get all the other, the SAPAFs, the Unity Forum of Family Practitioners. We then roll all of them in and we ask them as well to give their ideas. So it doesn't only become a SAMA thing, but SAMA takes the lead. And in future, we would make a serious request to the Minister of Health or the Presidency to please consult with your people that you have in South Africa. Then we go out so that we're all on the same page.
Right. Doctor, thank you very much indeed for coming through and giving us your perspective on this issue. That was Dr. Angelique Coetzee from SAMA. Appreciate your time.